I'm Michael. I'm a MS nurse and have been doing MS nursing for the last 13 years. I've been a nurse way before then, but I've branched into the specialty of MS nursing about 13 years ago. I'm joined today with the lovely Dr. Therese Burke,
Hey,
who's
everyone.
gracing us with her company today. I'll give you a quick intro to Therese, and then we'll get stuck into it. So Therese, Dr. Therese Burke, I might say, is a multiple sclerosis certified nurse and adjunct senior research fellow in the School of Nursing at the University of Notre Dame in Sydney. Therese worked at Westmead Hospital in Sydney for over 15 years as both an MS nurse and a clinical researcher, and has a keen interest in brain health and maintaining wellness for people living with MS. Therese's PhD thesis explored the lived experience of relapsing remitting MS and provided recommendations to enhance the life journey for people with relapsing remitting MS and improve quality of life. Therese's postdoctoral research study has explored the skill sets of multiple sclerosis nurses and defined the role in Australasia. Therese also works part-time at MS Australia, managing the clinical trial and allied health research platforms. So welcome, Therese. So very lucky to have you with us today. She's been a very busy lady in the last, I would say, well, for a long time, but in the last 24 hours during the last day, Therese was lucky enough and to represent Australia, chairing a session and presenting her research and chairing a session at ECTRIMS, which is the European Committee into Research into MS. Is that right, Therese? I think that's right.
Correct.
Get the acronyms correct, which is a great honour. Nurses are very seldom given that opportunity, but due to Therese's unbelievable breadth of knowledge in the area and the research that she's produced, that gave her that opportunity. So we're very, very proud of you for that great effort, and a real honour to have you with us here today.
Thank you, Michael. I'm so glad to be here with you too, especially to talk about brain health.
Yes, and that's exactly what we're talking about today. So I'm just going to look sideways at my little questions here from time to time.
No,
but today we're going to be chatting about managing brain health in times of crisis. And if we're not in a time of crisis at the moment, I don't know what we are. Things are happening all over Australia. That's why it's important to keep an MS nurse handy to help you on your wellness path of living with MS. And I think, I feel like a bit of a fraud coming in here today because I'm down in Tasmania, and seriously, COVID hasn't had a great impact on us down here. Every now and again, there's a little hiccup. If we don't want to leave the island, we're fine. So isolation in that sense is fantastic, but it's not so good if you're isolating yourself from the community and not actually attending your appointments or having research. I shouldn't say research. I'm trying to think what the right word is, Therese. Help me out here.
Oh, just your regular
attending your regular checkups and stuff
grease
like
and oil
that.
change.
That's pretty well the annual checkups and things like that. So, and that's kind of what we're going to be discussing today. So we'll hit the track and get moving with our first question for you. So, talking about the different ways people can look after their brain health and some strategies that they can use when things get a bit tough, and as we both just discussed, then COVID is certainly one of those times that we're faced with at the moment. So let's tackle the lifestyle factors. Why it is so important for you to look after your lifestyle factors such as diet and exercise?
Yes, well, I think about this a lot, Michael, and I know it seems hard because everyone hears diet, exercise, and thinks, okay, we get it. Why do you keep mentioning it? But the thing I love most about this concept is for anybody with MS, and it doesn't matter your education level, it doesn't matter what type of MS, where you're up to with your progress, what your symptoms are. This is something that you can control. And there's so much about MS that we all know that is outside of control. It's so complex, but looking after things like lifestyle factors, such as diet and exercise, puts you in the box seat. So they're things that you can choose. You can choose what goes in your mouth. You can choose the type of things that you might do for exercise. So for me, I think it's a really important way for people with MS to take a bit of control of their own life And
not just MS. I think any
chronic
individual,
illness,
regardless of
any individual, and especially chronic illness as well.
Yeah, absolutely.
And MS is just one example. And look, it's been easy to point to COVID as being a real trigger for people in this state, that different things can happen. There's been some people with MS who have taken the opportunity during isolation and lockdowns to really look after and focus on their health, sometimes for the first time, because they had more opportunity to do things like exercise and eat a little bit differently if they weren't always on the run. But for some people, it opened up opportunities to be worse, to give up exercise, to not have that moving around during the day that they might have getting to work, picking up kids, all that incidental exercise that people do, which still adds up to be really important exercise at the end of the day. So it gave some people a window to do that better. So we've got both groups of people, and then we've also got people that are probably somewhere in the middle. But you know what? For people with MS, that was exactly the same for people that weren't living with MS. In Australia, from research they've done, we had people who raced to it and embraced it and made positive changes, and people who didn't, and then people who were just in the middle that, went about things as normal. But
human nature, really, isn't
human
it?
nature,
Regardless
yes.
of whether you're living with MS or not. Yep.
Yeah, exactly. But it just gives you a chance to have some say over what's happening.
Okay, yeah, it's certainly, I think I'm probably as guilty as many of adopting some practices and not others.
Me too.
Yeah,
Me too.
As I said earlier, it's much easier down here in Tassie, though. You can just take off, not bounded by not being able to go more than 5K, not having to wear a mask. So clearly it's a lot easier to do a lot of things if you don't have to really take much into consideration, just get out and go. So very spoiled down here. So hopefully the rest of you will join us very soon in our
Hope so too.
uncomplicated lives, really. So we understand the importance of this. So exercise, but how is exercise good for your brain health?
Okay, so we avoided exercise for a long time in MS. I'm going back probably more than a decade, 15 years ago, and certainly 20 years ago when I first started working in MS. Exercise was something that people, particularly with more progressive MS, were advised to avoid because they didn't want to get tired out. But research has turned that completely on its ear, and we know that that exercise is important for everybody's brain health. And there's been recent studies in the last couple of years that have actually shown that exercise can have a positive effect on fatigue levels, which seems counterintuitive, but it can greatly reduce fatigue levels, and also help with bladder symptoms. Like, who would think that you could do a bit of exercise and help your bladder? But the research is there, and it's very strong evidence. So exercise can help with all of those things, with most MS symptoms. And I know that people will think, okay, I'm not particularly mobile. How can exercise still apply to me? But there's all different forms of exercise, and an exercise physiologist or a physiotherapist can give you really great advice on exercises specific to you. And it's also important for hand mobility. We talk about exercise in terms of walking and things like that, which for people that aren't able to ambulate like that can be a bit of a downer, but there are lots of things that people can do with their hands, because particularly as you do lose leg mobility, or if you have a relapse and lose that for a short period of time, your hands become even more important, because you need your hands then to help you with the mobility aids. So finding ways that you can exercise your hands is also really important. And when I say exercise, I'm going to include a third thing here, which is exercising your brain. So doing activities that help your brain muscle, doing, whether it's reading or puzzles or finding activities that bring you joy, things that make you, hobbies that make you think, that put you in social contact. That's all really, I classify that as a bit of brain exercise.
Oh, absolutely. And I couldn't agree more. Exercising the brain is just as important as exercising the body.
Helps keep your weight down as well. Exercise is important for that. Help keeping your weight down, which we know is important for MS progression as well.
Yeah. So that's fantastic advice. And as I said, I'm one practice that as well. I do lots of little things to trying to learn, getting back into learning my guitar again, and I do a bit of language. I've got a little app on my phone that once a day I sit down for
They're
10 or
wonderful
15
aids.
minutes and try to learn Spanish. So little things like that just stimulate
Little
the
things
brain.
add
It's
up
really important
to
to
big things.
absolutely.
Little things all add up to big things. So
Yep, that's the way it goes. From little things, big things grow. Don't we know that so well? Just having another quick look here. Oh, here's another really important little question that we need, or topic to delve into, and that's smoking. Can you tell us a little bit about the impact of smoking and MS?
Smoking and MS. We've made great strides with understanding the role of smoking in MS in the last few years, and smoking can negatively impact on MS in two ways. The number of relapses and also in progression of MS. So therefore it applies to everyone. And smoking is one of those behaviours that sometimes people use to cope with stress, or they might be using it to cope with some of their MS symptoms. And so it's really important that we get people that are still smoking after their diagnosis of MS to really think about quitting. It's so important. There's actually been, and this is very topical because this research only came out this week on Monday, and it's in a very prestigious journal called Brain, which is one of the top neurology journals in the world. And it's new research showing that when smokers quit living with MS, the disability accumulation really slows down, and it can get to the level of a never smoker, which is a really important breakthrough to understand that. So even if you've been smoking for a long time, there's still ways, there's still so much benefit in quitting, particularly for the brain health.
I think that a lot of people now, well, I've been smoking for 20 years. What difference does it make if I quit now? So that's research will clearly,
a lot of difference.
Give a lot of ammunition to saying to people every day less that you're smoking is going to be a benefit
is better. And look, the thing is that smoking can be really hard to quit. It's not one of those things that if you're not a smoker, it's hard to understand why you just wouldn't want to quit. But there are reasons why, particularly in MS, that it can be incredibly difficult. And this is where your MS nurse can really give you some sound advice about perhaps being referred to a service which gives you a lot more support, because you might need that support to get through this successfully. So ask your MS nurse about that sort of support as well, and places that you might go where you might get that little extra support to quit.
And sometimes that's all that's needed. Just a little bit of
it's just a bit of help along the way, instead of just being sent away and told, well, you need to stop smoking. You need to have the resources to enable you to do that. So
heading off to the pharmacy to pick up your Nicobate and stuff like that. It's a little bit deeper than that, really, isn't it?
It is. And some people need different techniques. They might need counselling and Nicobate and a third tool. And so when you have serious smoking cessation strategies and advice, that can really give that extra layer to make this a success. So talk to someone about that.
Sound advice, absolutely. I think that's certainly one of my bugbears as well, trying to impress upon people that level of importance of doing away with the cigarettes if you can. Not easy, as you say, but keep digging away at people, and hopefully they will take that message home. Where are we up to now? Finding ways to unwind and reduce your stress level. That is, mindfulness is like the topic of the century, I think. Everyone's talking about it and understanding it. But tell us a little bit how important it is for people to get control of their stress, especially people living with MS.
Well, it's so important, Michael, because reducing stress not only just helps your general wellness and other signs like physical things like your blood pressure and things like that, but also your mental health. So if you're highly stressed, there's enough things that put you at risk of some of the mental health issues that are prevalent in MS, such as anxiety and depression, and increased stress on top of that, and you just get this vicious cycle. But there's lots of things you can do to look after your mood, and it's really critical, I think, to reach out for help as early as possible. So don't wait for it to get bad before you put your hand up and say something. If you feel like that stress and issues with mood is beginning to be a problem for you, speak up early, get help early, and then have the interventions. But it's not all sitting in the lotus position. I just want to make that really clear, like meditation, which is looking inward, or mindfulness, which is thinking outward and taking note of your surroundings and the detail going on around you. It's not just about that. So you've got to find, it's not the same for everyone. I mean, I tried to meditate years ago, And I just couldn't. I've just got one of those really busy minds and I can't sit still for 2 seconds. So I found it more stressful to try and meditate than not. So it's not for everyone, but you've got to find what works for you. And then for me, I found that just walking in nature gave me that meditative effect. If I could just get out for a hike or get near the beach or get near water, that actually brought me a lot of calm. Just watching the waves for 10 minutes. So it's finding what works for you. And that might be sitting down and petting, having your puppy dog on your lap and just petting that, or it might be just a friend that really gives you meaning and makes you feel good. But finding and Sally Shaw did a presentation this morning, which I went to before this, and she had this wonderful few words, and I wrote it down. It's called Fortress of Habits. It's all the little things that you might do to reduce stress, which don't seem too big in the big picture, like going for a walk or talking to a friend or having a cup of your favorite type of tea, but you add them all up and they can have a really big effect. So think about it like that.
Nuggets of joy. We call them nuggets of joy.
Nuggets of joy, and building up your
collect
little
a few
fortress
of those through the course of the day. I think, that leads so much positivity, and it just helps you to appreciate, the small things in life. As I said, one of my favorite sayings: Mother Nature is incredibly generous for those who sit and take time to observe.
Yeah, and I couldn't agree more.
And you know why it's my favorite? Because I've said it.
Yeah.
That's my little saying. And I always, listen to the birds, look at the sunrise and things like that. Anyone on my Facebook feeds would certainly get sick to death of me posting pictures of magnificent sunrises, but so easy to just sit for 5 minutes and look at it and just find that beauty and relish it.
Find that moment of joy for you. Yeah.
Absolutely. We better get moving because we're going to run out of time otherwise. So the next little topic we're discussing is the importance of clinical monitoring. If MS gets talked about a lot, it's just a way of moving forward and finding what's happening when things aren't going well. If you're having a relapse, the importance of making sure that you're reporting those symptoms to your nurse or your neurologist.
Yeah, so important for brain health, but also so important through a period like COVID, because we know from research that's been done in Australia that people with MS, some people became more fearful of going for their normal appointments or going for their MRIs because they were worried about getting out into the community. Completely normal feeling. I mean, people with MS and without MS had that feeling about keeping up those regular medical appointments was a real challenge, because you had to weigh up the benefits and risks of, well, if I go for my MRI, I might be exposed to COVID, but if I don't, what will happen? The short answer is that in MS, clinical monitoring, which is looking at the progress of your MS and the activity of your MS, is critically important, because we know that we've got symptoms. It's almost like an iceberg. You've got your symptoms and relapses on top, which are obvious. It's obvious the symptoms that you're feeling to you, and relapses that might happen. But it's really the iceberg under that water that is going to dictate what's going to happen to you in the future. So, we know that, and MRI monitoring, I'm mentioning that because it's probably one of our most critical ways to monitor your disease. So even when you're feeling well, there can be activity going on beneath the surface. And the MRIs, particularly today, because they're so sophisticated and they give us much more information than the MRIs of even 10 years ago. And we can detect tiny changes. And look, we know that only about 1 in 10 lesions in the MS brain shows up as a relapse. So that means that there's lots of activity going on underneath the surface. Now, we want to pick that up if it's happening, even if you're feeling well, because it might mean that you need a change of treatment, or we need to start thinking about changing treatment or monitoring you more closely so we don't miss a change. So critically important to stay with your monitoring programs, even in times of crisis.
And as we mentioned earlier about the annual, grease and oil change, it's important to ensure that you're having your annual skin checks, mammograms, whatever other tests you would normally be happening, because some of the MS treatments do have an immunomodulating effect, and that can cause a slight risk to increase in skin cancers and things like that. So it's so important to ensure that you maintain that annual check on those other things that could be going on as well. Keeping on moving along here, we've got what's your next question here about some things that MS nurses can do to help people with their clinical monitoring and their brain health. Tell us a little bit about that, please, Therese.
This is my absolute passion about what MS nurses can do. And that's MS nurses working in the community through things like MS Connect. It's MS nurses working in hospitals and clinics, MS nurses working for pharmaceutical companies. You may be on a patient support program and have an MS nurse as part of that support. So there's MS nurses in all sorts of different communities and settings, but they all do a group of things incredibly well, and that's what's really helpful here for brain health, and is that MS nurses are very gifted educators. They have, they're very skilled, and they're very good at delivering information that's suited to an individual. So they're very good at working out how to provide that information for you. And the reason I mention this in brain health, Michael, is that if you understand as a person why you're being asked to do these things, why you're being asked to have your MRI 6 monthly or 12 monthly, or have your bloods done at certain times, or take your drug at the same, at a certain time of day, or whatever it is that in your prescription, and not just drug prescription, but intervention prescriptions and things like exercise. If you understand the reasoning behind that, you're going to be much more likely to follow up with the behaviour, to continue to do positive things for your brain health. So if you don't understand why something is happening, or why you need to do things, or why something might be advised, talk to your MS nurse in whatever capacity that is, and ask them to explain and clarify why, so that you can understand your role in looking after your brain health, especially during a crisis such as COVID. I think it's probably doubly important.
And I couldn't agree more. I mean, we're small in numbers, but my gosh, we're pretty amazing source of knowledge, and we shine brightly when we're given that opportunity to do so. And we understand MS. We don't have to live with MS to truly understand it. We listen to the stories almost on a daily basis of what people are going through. So, and MS nurses are everywhere. They're, as you said, they're at clinics. Then not every neurology practice has an MS nurse attached to it, but you know what? You can find us, because all you have to do is ring MS Connect, and there's nurse advisors there that can absolutely jump on the phone and give you the advice and support that you're seeking. So don't be afraid to pick up that phone and ring, or as I said, use the resources that are available through the clinic that you attend as well. We're there to help, and we're there to support, and we've got plenty of us, not lots of us, but certainly, and we know, Therese and I both know very well that when people get asked the question, who was one of the most important persons that they go to for seeking advice, and that when they begin their journey with MS, it's often the MS nurse who's their number one support person, because of the fact that we've got the time, we've got the experience, and we've got the knowledge, and we're only so happy to share it with you. So use and abuse, as I say, go for it. We'll better get things wrapped up here. So a couple of little gems little tips that you would say is important for everybody in relation to managing their brain health. Give us 3 of your best, please.
Oh gosh, 3 of my best. Put some thought into how you want your life to be with MS, and talk to other people about what that might look like, so that you get a plan about the things that you can do preventatively to look after yourself. It's not going to happen by accident. So the things that we talked about just briefly today: diet, exercise, stopping smoking, looking after your mental health, looking after flexing that brain muscle, keeping your weight down. It seems like it's a lot, and it is a lot. So tip number 1 is perhaps just putting it into bite-sized pieces, and maybe doing 1 or 2 things at a time, and trying it out and see how it feels. Get used to that. I think sometimes doing everything at once is just way too overwhelming, and it's probably not going to work in the long term. So doing little bite-sized chunks is good. The second thing is that you obviously have to consider your abilities and what you can do easily, and what's going to be more challenging for you, and get help in those spots where you can recognise that it might be a challenge. And some examples of that is perhaps getting an exercise physiologist or physio to help with exercises to use at home if you are somebody that can't get out for a walk or aren't able to ambulate, find ways that you can stay active, even within your own home setting, or even now we've got a lot of telehealth options for rehabilitation and exercise that we didn't even consider 3 years ago. Just thought that was impossible. But obviously now with COVID, we've been given some opportunities that weren't there before. And how wonderful if we can take those things post-COVID and make them work for us. And that's even things like telehealth for your MS appointments, where you might chat about your monitoring or might chat about your symptoms, that there's opportunities to do that weren't there before. So find what works for you and make that happen. I think I've given 2 things there. My third thing, and I always like to talk about this, is know your numbers. And that's things like, Michael, you touched on as well. MS is so complex that it's easy to get carried away with all the drugs and the medications and exercise and diet and smoking and all of those things, and forget that other things happen in the background living with MS too, of course. There's other conditions that happen. Some people might be living with 2 or 3 significant chronic illnesses. So they all impact on each other. So know your numbers, and perhaps even sit down with your GP and work out all of your different issues and what you can do to proactively manage that. Because if you manage your other conditions as well as your MS, that helps each other. It helps each condition. An example of this, and it's really topical at the moment because it's spring, is hay fever. Hay fever is a very common comorbidity. That means a co-illness that people with MS might have. And if it's badly managed, you might be living with significant MS fatigue, cognition issues, things like that. And then you have hay fever on top of that, and it can be absolutely demoralizing because, you know, you've got blocked up nose, you're not thinking clearly. And so that's what I'm saying. Get things managed, because in the end, your MS will benefit if the other things in your life are looked after. And know what your blood pressure is, know what your cholesterol is, look after all those comorbidities and have your skin checks and things like that.
Yeah. And I think it's important to realize that some things are not in your control, and you can waste a lot of time worrying and trying to manage something that you'll never really truly manage. So sometimes you're better off letting go of those things and actually draw your focus in to the things that you can manage, the things that you can change and make a real positive difference in your life. And I think, if you can weigh that up, get the scales in balance and let go of the things that you'll never be able to fix. But hone in and really
and really work out. And that's going to be different for everybody. Every individual is going to have different levels of priority and need and what matters to them. So really hone into that. So I think we could probably talk about this. I know I could, Michael, for the rest of the day. But we better
definitely,
get people on their way. But I just wanted to close by just mentioning that, look, COVID happened. And it's still happening. And we wouldn't have imagined in March last year that this would be where we could get to. As Michael knows, I was actually living in China when COVID first struck, and I had to move home in a hurry, and there were issues. But I never would have thought last March that we'd still be here now and what was happening. But when you think about it, like, this is probably one of the hugest impacts of crisis in our life. But for people living with MS, they've lived through this and more. They have seen many different types of crisis before, and we will see it again. You know, we also had bushfires a couple of years ago in New South Wales that were devastating, and there's been floods around the country. Life is going to happen, and there's going to be more crises after COVID. Hopefully we'll never see something with as big a global impact again. But in times of crisis, we really need to up the ante. Sometimes in times of crisis, it's easy just to let it all go and think, I just can't cope with this, I'm going to let it all go. But we really need to think about upping the ante and committing even more than normal. So this is why the health plan is so important, and getting back to basics and working out what's important to you to stay as healthy as possible. So, and if you're not sure how to do that in your life, because MS, as we know, doesn't come with a guidebook, doesn't come with a rule book, that's where the MS nurse and MS Connect nurses can really help get you back onto track and work out your pathway. So don't be scared to ask them, and don't be scared for that clarification about how to do that in your life. They've seen it before, they've heard it before. I think MS nurses are probably one of the least judgmental groups of nurses I've ever known, and they're great storytellers, and they can really help find what's going to resonate with you. So just, you know, feel free to open up and ask.
I could not agree more, Therese. And we'll finish up now. Just a massive thank you to you. I know how busy your schedule is, and I know there's other stuff going on in your life. So I so appreciate the fact that you've come along today and spend this time chatting with us. And, you know, you're a gem. I love you. And I thank you so much for your time
My
today.
pleasure, Michael. And thank you for the audience for tuning in.
Yeah, thank you indeed, yes.
And the MS Connect number has been shown a couple of times. So you can always
Excellent.
look it up on the website and there it is
All
again.
right.
So
thanks,
okay.
everybody. Take care, stay safe, and we'll see you around. Ring
Have
us
a
and
good
have a
day.
chat to us.